before the class start, I would like to, wish everyone a happy new year. I think, I wish everyone a happy life, a lot of health. I think that's important. And maybe a little bit wealth also. All right. So does anyone want to just share something, maybe wish something, or just to talk a little bit before we start the lecture? Come on, guys, it's New Year. Just share what you do. What do you do for the first 3 days? Anything fun?
You guys try to speak something.
Yeah.
Yeah. You should. This one is English class, so you should practice it.
I mean, this is the best time to practice, right? So, all right, number 90, Đàm Như Bình.
Hello, teacher. I want to share a Happy New Year, and I want to share about my Tết holiday. And I wish teacher Định and you have a Happy New Year and successful. And in my Tết holiday, I come back to my hometown in Hậu Giang, and I meet Hậu Giang with a lot of river and fruits, and I visit my friends, my my aunt, and a lot of children.
That's great.
Cháu trai.
Yeah. So Dao is nephew.
Nephew, yes, my nephew, and I feel very happy with the bánh tét.
Yes. All right. Does anyone know how to say bánh tét in English?
Bánh tét tiếng Anh là gì ta?
Huh? Does anyone know? And then, do you know?
No, actually, before we just call a rice cake, but rice cake is very, very general terms. And now the tradition, the trend that we try to keep the original one, like we don't say the Lunar New Year anymore. We just say Tết, or we say áo dài, or we say phở, or say bánh tét. But do you know any English word about bánh tét or something? I really don't know about it.
I call them rice cake, but I also teach people how to say bánh tét. It's fun. It's fun to say bánh tét. Yeah, like bánh tét, áo dài. We're still trying to say it. Okay. All right. I mean, thank you. Anyone else want to share how much money did you get for that, or how much money did you have to give out for that?
How about you cost a leasing?
Yeah. I mean, this is my first year. I have to give leasing to my cousins because I'm old. I have a kid, so like I have to give a lot of money, and it can be very costly. Okay. All right. I think today lecture is really long. I'm not gonna do the same thing that I did before. I think more of this lecture is I'm gonna try to maybe help you guys pronounce some of the words. I'm not gonna try to go too deep into like what do they mean or what do each structures do, because that's just too specific. The brain is very complicated. To be a neurologist, it takes so many years, so it wouldn't be fair just to ask you guys to learn about these terms within just 2 hours. So I think that's not fair. So it's mainly is to know the general terms and how to say them correctly, and how to recognize some of the abbreviation that we see, that people use so often in the hospitals, and it should be good that you recognize them. I think it's very helpful. Okay. All right. So today is about the nervous system and the skin. All right. So before we always start with the terminology, so the brain is very complicated, and every root have a different meanings, but some of these are some of the common roots that you see with a lot of terminology that associate with the brain. So I want to go through some of them. So I say the first one is neuro. So does anyone have sort of an example what the words neuro means, or you have an example? Let's pick somebody. Okay, I feel like that, so everyone is still a little bit slow. So let's do 47. Nguyễn Thị Anh Thúy, can you tell me neuro? Just give me an example.
Neuro belong to brain and nervous system.
So let me ask you, what would you call a doctor who studied the brain? Let's say,
Can you repeat your question?
okay, so for example, a doctor who studied the brain, what would you call it? What would you call him or her?
Neurologist.
Okay, so it's neurology. Okay, so you have to, so ology is the study, and then you add the neuro to it, so it's neurology. Okay, can you say it again?
Neurology.
Good, perfect. Yeah, very nice. All right, I like that. Okay, so the next word, I think most of you probably not gonna know, is basically is a type of cells inside the brain. Is, you know, we don't use that a lot. So I'm just not gonna ask you even get an example. Is ganglio. So it's basically ganglioma. If you heard about it, so it's like a kind of a benign tumor. So we call it ganglioma. Okay, so I'm just gonna ask someone just to repeat, you know, the word ganglioma, because I want you guys to practice a little bit more. All right, let's go for number 29. Can you pronounce the word? My naman.
Ganglioma.
Okay. Say that one more time.
Ganglioma.
Okay, good. So oma. I like that you put the emphasis on the oma. So it's ganglioma. Okay, good. All right. Do you want to?
Thầy, cái này là cái u tế bào thần kinh đệm đúng không thầy nhỉ?
Yeah. I don't know what it is in Vietnamese, so but I just know is oma is a type of tumor. It's usually a benign tumor, and then we add the ganglion. Ganglio is like a part of a ganglion.
Yeah.
I do not know what it's called in Vietnamese. I'm sorry.
Tế bào đệm, tế bào đệm.
Yeah. Okay, so let's go for the next one. So meningo, this is very common. I think most of you guys know. So let's say, for example, if you have an inflammation in, you know, this part of the brain, what would you call that? You know what's inflammation cause, you know, itis, everything this end with itis mean inflammation. So if you add them together, like what would you call that part? Anyone want to volunteer? All right, so number 90, did you raise your hand or somebody else?
No, she did that. Not
Okay.
now.
All right, there's so many people raising hand. I am
Yeah.
confused. Okay, so let's do 83, Nguyễn Quế Trần.
Yeah, so meningo meaning belongs to the meninges, and example like meningitis.
Perfect. Yeah, meningitis. That's very common. Yeah. So yeah, so usually people will present with, you know, fever, headache, and they have this, you know, stiffness in the neck. So usually that's the signs of meningitis. Okay, perfect. All right, how about Milo? Give me an example of Milo, or this one is a little bit tough, so I'm just gonna tell you guys. So Milo is basically part of the spinal cord. Also sometimes it can belong to the bone marrow also. So if you have a tumor in the spine or in the spinal cord, how would you say it? All right, I'm gonna call someone since let's do number 49, Nguyễn Thị Văn Ánh or An. So
Yes, I'm here.
yeah. So how would you pronounce this?
Radiculo. Radiculo.
No, this one. This word.
Myeloma.
Perfect. Yeah, so it's oma and then myeloma. Okay.
Sorry, it's very noisy in my neighborhood. Sorry.
Yeah, that's okay. I mean, as long as you pronounce it correctly, I'm happy. All right. Right, let's go for the next one. Ridiculo. So this is a lot of time when, you know, patient come to you and they complain of this pain. You know, sometimes it radiate, you know, from either from the neck to the arm or from the leg down. So give me an example of you know, what does ridiculo mean? Let's pick number one. Bùi Hương Ngọc, I think you muted.
Oh yes,
Okay.
radicular is mean belong to spinal nerve root.
So give me an example.
Radiculopathy.
Okay, so let's break it down a little bit, okay? So ridiculo. So you just say ridiculo, and then pathy, radiculopathy. So you have to pronounce the law like lopathy. So radiculopathy. Try that one more time.
Radiculopathy.
Good. Yeah, pathy. Yep. Lopathy. So for example, someone who come in with, you know, pain that going down the arm, you can say it, you know, radiculopathy pain. So that means that it's kind of like a nerve pain. When you say that word, people automatically associate with the pain from the nerve instead of a regular pain. So radiculopathy, that's the term for it. Okay, very good. All right, let's go for the next one. These are roots for the brain. All of these, I think you probably at some point had come across these words. So let's say if you have someone who come in, you know, instead of the meningitis, which is a meninge, so headache, fever, and neck. Now they actually have like a little bit of confusion. They have also headache and they have fever. What am I describing? It's inflammation of the brain. Number 58, Mỹ Giang Phạm Mỹ Giang. You muted.
This one
So,
is encephalo.
Okay, encephalo.
Belong to brain.
Okay, all of them are belong to brain. So how would you say inflammation?
I don't know, sorry.
Itis. Anything that inflammation, itis. Yeah. So, and then you add the brain to it, right? Encephalo, and then encephalitis, right?
Yeah.
Anything that have inflammation, you just add the itis to it. So, you know, encephalitis, meningitis, you know, encephalitis. So encephalitis. Okay. So, so this one is okay. So this one is not encephalitis, but this is an example. So how would you pronounce this word? So forget about the an. So how would you say this? Encephaly, right?
Yes.
Encephaly. Yeah. And then you put the n encephaly.
Encephaly.
Yeah. What is that an means? I mean, if in front of the word. We talked about this last week.
No. Zero.
Good. Exactly. So no brain, right?
Yeah.
So it's a missing part of the brain. So anencephaly. It's usually occur in, you know, young children. They could be missing half of the brain. So perfect. So you remember. So anencephaly mean that they missing or they have no brain. Good.
Yeah, thank you.
Yeah, and then will be very proud of you. All right. Next one is cortical. All right. Someone give me an example. Let's go 68. Trần Hồng Nguyễn.
Yes.
Oh.
Cortex meaning cerebral cortex. Example, cortex cause spinal.
Okay. Let's go back. Okay. So if you have a very complicated word, you can try to break them down. Okay. So which word can you see in those two? Which one are you familiar with? Do you see anything that you recognize? Spine, right? Right.
Yes,
Spine.
I see.
Yeah. Spinal. right?
Yes.
Yeah, I mean, even if you don't know the word, you can sort of understand that it's spinal, right? Spinal is part of the spine. So you can say spinal first, right? And then you add the cortical to it. So
Okay.
it's cortical spinal, right? See, it's not that hard. You just have to break them down. So cortical spinal. Yeah. So say it slowly.
Now,
Yeah.
yes.
What? Repeat it. Yeah.
Cortical spinal.
Yeah, perfect. So, cortical spinal. Okay, good. See, don't be afraid of the words because, it can be very complicated, but just break them down. Break them. If you don't recognize something, just try to, find the words that you're familiar with. So in this word, you probably don't know cortical, but you know spinal. So you can say cortical spinal. Okay. All right, let's go.
Cái này tiếng Việt là màng tủy đúng không thầy?
I'm really sorry. I really don't know these words in Vietnamese because I wasn't trained in Vietnam, so it's very difficult for me to know these very special terms. So I would not be able to confirm that with you. And then probably would know, but I
Teacher.
Xin lỗi nói tiếng Việt. Cái này là cortical là cái vỏ đó mấy em.
Vâng, thế đây cái này tiếng Việt nó là màng tủy thầy ạ, đúng không ạ?
Không phải màng, không phải
very
vỏ.
Em đoán là vỏ não chứ.
No, the cortical spinal is different. It's a tract. It's a cortical spinal tract because in your spinal it have different tracts. So the cortical spinal tract is a different part of the central nervous system. I it's very specialized, so I cannot tell you the Vietnamese word. But it usually you say the cortical spinal, it belongs to the tract that can control the motor symptoms and the other symptom versus cerebellar spinal. They have multiple tracks, so I can't tell you which one.
Nếu mà nói như vậy là cái đường dẫn truyền từ cái vỏ não xuống tủy, có thể là như vậy.
Có thể là như vậy. Yeah.
So
we don't know.
So for cortical spinal, I guess it including two root words and connected with old vowel sound. And in the cortical spinal, we don't have a suffix or prefix, right?
I mean, the cortical itself is a root, and the spinal.
The spinal is another root.
Yeah, it could be another root, or it could be another ending. So so they are probably two roots.
This is a tract, so it's an end to end. One end cortical and one end spinal.
Yes.
Perfect.
Thank you.
Okay. All right. Let's go to the next one. Cerebellum. Cerebellum is part of the cerebellum. I think some of you guys may know the cerebellum is the part that control the coordination of in the brain. But some of the example, I want somebody to try to say that word. See how scary it looks. Very scary, but it's actually quite simple. You break it down. All right, let's pick number 69.
This is the cerebellum.
Yeah, let's say this word. The example.
Supracerebellar.
Perfect. Yeah, I like that you break it down. So what does supra means?
Supra means above. So I think it's above the cerebellum.
Good. Yeah, that's very perfect. Yeah, supracerebellar. All right. Next one is psych. I think a lot of you guys know. Let's say a person who study, psych. Like how would you say that in English? What kind of doctor is that? Let's go for number 40. Nguyễn Thị Dung.
Psy mean mind, meaning it means mind.
Yeah. So let's say a doctor who study the mind. What do you call them?
Psychology.
Okay. So psychology or psychologist?
Yes.
A person who.
Psychologist.
Okay, just ST, okay? Psychologist.
Psychologist.
Okay, good. Besides psychologist, usually a difference between, so there's also another person that can also study the study of mind. So can someone else give me another name for a doctor who studies the mind? Let's do number 18, Huỳnh Công Trung.
Those work you already,
Psychology.
those work you already learned,
Yeah.
from session 2.
A doctor who study the mind of a human body.
Psychologist.
So psychologist is one. There's another person, and I'm gonna ask you what's the difference between them. If you don't know, that's fine. I mean, anyone who knows can raise their hand.
Psychiatrist.
Okay, so back up. Psychiatrist. Remember, if you cannot say it, just back up a little bit. Trust, psychiatrist. Okay. Perfect. Yeah. So psychiatrist and psychologist. What are the difference? Why are they different? What's the difference between them?
I think psychiatrists give medicine for treatment disease serious than psychologists. Psychologists give some advice to change life style or change the mind of patients to.
Okay.
I think,
yeah. I think you get the idea correctly. Okay, so just one advice: when you say somebody like a doctor give a patient a medication, instead of say give, you can say prescribe. Okay, so a doctor prescribe medications. So that's the difference. A psychiatrist is someone who went to medical school here in the United States. They are licensed to prescribe medications. Okay, it's very different from psychologist. So psychologists can make the diagnosis, but they cannot prescribe medication. They can only do, they can interview patient, they can make the diagnosis, but no medication. Okay, yeah. So remember, when doctor give medication to a patient, you can say prescribe to be more professional. Okay, you don't have to say give, medications. Okay, yeah.
Okay, see, I just speak a little bit Vietnamese here to clarify about that two terms. So psychiatrist là bác sĩ tâm thần của em, là bác sĩ. Psychiatrist là bác sĩ. Rồi psychologist chỉ là chuyên viên tâm lý thôi, không phải là bác sĩ. Do đó cái này là bên Việt Nam có nhiều người tự xưng là bác sĩ, cái này mình biết, nhưng mà họ là psychologist, không phải là bác sĩ. Không phải. Okay.
Good, thank you, Endon. Okay, so also when we have a medication that affect the mind, we can also call them like psychogenic. Okay, so like psychogenic medications. All right, so these are. Yeah.
I have a question. For the previous slide, can you back again, please? Yeah, I have a question regarding the cerebellum, because according the dictionary, it indicated that there are two forms of the plural forms of cerebellum. They are cerebellar and cerebellums. So I don't know which one is more popular than the other one.
Yeah, so
thank you.
Yeah, so they actually part of the same word, but when you say cerebellum, that's a noun. Okay, cerebellar and could be used like an adjective. All right, so let's say you say so part of the cerebellar, like a structure of the cerebellum, you could say the cerebellar, like supracerebellar structures. So one is adjective, the other one is a noun. Okay. Do you get it?
I just wonder the noun of this one, because I see there are two forms, cerebellar and cerebellums, with the S at the ending. So I just wonder there are any difference between them.
So I think the cerebellar is when you use it, it's almost similar to like an adjective, and cerebellum is when you talk about just as part of the brain. like a cerebellum, just that the part of the brain only. But when you use cerebellar, when you talk about that part, then you can use the cerebellar.
Sorry.
So
I think that her means is cerebellum, and cerebellar is the ending UM and L in A. And I think that is one. It's also talk about cerebellum, but the cerebellar is that two cerebellum, and cerebellum is just one thing.
No, it's the same word. It's just used in a different context. You know, like let's say if I go back, right? If I say cortex, that's the noun, right? But then if I use it in the cortical, that's the sort of like adjective to it, like a prefix, kind of like the same thing with cerebellar versus cerebellum. Okay, so let's say if I use a word, supracerebellar is an adjective, so I would say supracerebellar mass, right? Like it's something after that. It's the same. It just means that they just give the meaning to the location. Okay, so you wouldn't see a word like supracerebellar. It's not a noun. It's an adjective. So they would say supracerebellar mass, supracerebellar structures, or something. So that's what I meant. Like, it's one is the nouns, the other one is an adjective.
No. I mean that's the A is not A.
Dưới lều thuộc về dưới lều ấy ạ. Nó có dưới lều tiểu não ấy. Nghĩa là cái từ này là tính từ, em nghĩ là cái từ này là tính từ và nghĩa tiếng Việt của nó là dưới lều tiểu não, thuộc về dưới lều tiểu não. Nên là mình sẽ nhìn cái phương pháp phẫu thuật dưới lều ấy.
Một cái là tính từ, một cái là danh từ.
Xin lỗi tại vì em bị hiểu nhầm. Em tưởng bạn ấy hỏi là cerebellar là cái từ ending nó chỉ bằng chữ A thôi, tức là số nhiều của cerebellum ấy.
No, it's not like that. Tại vì cái cerebellum, there's only one cerebellum. So
Vâng,
có một cái là
nó là cerebellar chỉ kết thúc bằng từ A thôi và không phải là tính từ cerebellar.
So cerebellar là tính từ, có nghĩa là khi mình nói là
không có chữ cerebella mà không không là chữ A phía sau hết đó. Lầm là bacterium á, nhưng mà cái cerebellum, no cerebella at all, no. Em có hai cái tiểu não đúng không?
Vâng, ý em là muốn nhắc đến nhiều tiểu não, nhưng mà tại vì
okay, I get it. See, I don't study the brain, so it's very difficult. So I think you're right. Cerebella is a plural, but when you add the AR at the end, it's an adjective. I understand what you mean now. Yeah. Okay. Yeah. Can we move forward, or I think we might have to double check on that. But I think that is the cerebella. It probably mean is probably like the plural form of the cerebellum, and the cerebellar with the AR is an adjective. Okay. This is just way beyond my specialty.
No. If you talk about the researches về nghiên cứu thì cái đó thì mình có thể viết trong đó, nhưng mà trong cái bệnh lý thì không có hai cái. Okay.
All right, let's go. So these are the words are very common, especially if you have a patient who have a stroke. So I think it's useful to know. I want someone to give me an example of a root word that have the aphasia to it. Let's see. Does anyone want to volunteer? Or 46?
Okay. Aphasia, it means speech. And I have two examples for aphasia is aphasia and dysphasia.
Okay, so aphasia is what?
So aphasia is you unable to speak or unable to communicate with other people. And dysphasia is mean the disorder of speech, right?
Perfect. Yeah. Aphasia. So dysphasia or aphasia. Sometimes they can say, you know, the adjective for aphasia is aphasic. You know, sometimes people will say, oh, that patient is aphasic, mean that they can't speak. Okay. Or they could say dysphasic, mean that the patient can speak, but their words and their structure doesn't make any sense. Okay, perfect. All right, let's go for lexia. Does anyone know what lexia means? Can you give me an example? Number 60 from Phan Văn Bảo.
The lexia is meaning reading. And
okay.
Another example here, this lexia.
Okay.
Is lexia is meaning the difficulty to reading. Yes.
Okay, so dyslexia. Okay, yeah, when you pronounce the X, you really have to put the emphasis on it. Okay, so lexia. So trying to say it a little bit, you know, stronger. It's like dyslexia or lexia. I thought you guys gonna say Alexia. You know the Alexa.
Just Alexa.
Yeah.
Yes.
Yeah, Alexa. Yeah, so you know, sometimes people, when you say that in front of a phone or something like that, it recognize Alexa. Okay, let's go for the next one. Let's say number 7, Đỗ Thị Nga. Let's try. Yeah.
Yeah. Plasia.
Plagia.
Plasia.
Yeah.
Yeah, and that's mean paralysis and
So we'll go back up. So so the word, the emphasis is on the ISIS. So say that again, like it's not paralysis. So it's the emphasis of the word is on the RAR. Right? Yeah, so paralysis, because when you first say the word, you put the emphasis on the ISIS. So you're like paralysis, but it's actually paralysis. See that the difference? Yeah, paralysis. Yeah.
Paralysis.
Yeah. So the R, the paralysis is the emphasis. So paralysis. Okay.
Yeah.
Right, so let's go for this word.
Here we have the tetraplegia.
Okay.
That's
so yeah.
What does that mean? You
What's
can move.
What is tactra means?
It means that you can move your legs or your arms because of the stroke or something like that.
But what is tactra?
Tactra is 4.
Good. So
4.
How many limbs do we have?
We have 4 limbs.
4 limbs. So tetraplegia means that you cannot move anything. I mean, you could have a stroke that you have 2, right? You could move half of your body. How would you say that if you only move half of your body?
Hemiplegia.
Hemiplegia. So yeah, plagia. It's difficult. It's plagia, tetraplegia. Yeah, hemiplegia. Perfect. Yeah. So that's basically the number of the limbs that you can move. All right. So tetraplegia means 4 limbs. You cannot move them. All right.
Yeah.
Perfect. Next one.
I have a question.
Yeah.
Sometimes I see the word quadriplegia.
Yeah.
That's equal mean with tetraplegia.
Yeah.
So
what is quadri?
Is quadri is 1 4.
Yeah. It's a scheme. There's many different terms for the same, meanings. Most of the time I do see that it's quadriplegia. We don't see tetraplegia a lot. But
quadri is a root from the Greeks. Meanwhile, tetra the roots from Latin. Just medicine, you have a mix of Greek and Latin roots. So sometimes you see one another.
Yeah.
Okay.
But the important that you recognize the plagia, because that's mean paralysis. Okay. Yeah.
Okay.
All right. Next one. Anyone want to volunteer? Let's go for 53. Nguyễn Tuấn Huy.
Yes.
Yeah. Can you give me an example and What does that mean when we say paresis?
I think it's meaning partial paralysis, but paralysis or weakness.
So you have the same problem at the previous person. Remember what we put the emphasis on the word? We don't put it on the lysis. We put it on the ra, so paralysis. Okay.
Yes.
Yeah, so it's paralysis. It's not paralysis.
Yes.
Okay.
I know.
So, yeah. Just it's the same word, but if you say it, you put the emphasis on different, part of the word, it could mean it just sounds off. Okay, so paralysis instead of paralysis.
Right.
Okay, yeah, it's good. So, oh yeah, someone say early, Hemi. So how would you say that word? This one.
Hemiparesis.
Okay, good. So break it down. Hemiparesis is E. Okay, paresis.
Yes.
Yeah. So hemiparesis. Yeah, give it a try.
Hemiparesis.
Good. Yeah, perfect. Yeah, just slow down, okay? Yeah, so hemiparesis. Yeah. All right. Next, let's go for the next one. Let's do 72. Trần Thu Phương.
Let's see. Meaning seizure.
Okay, good.
Example, like
how would you say that word?
narcolepsy.
Good. Have you seen anyone with narcolepsy? Does anyone know what's narcolepsy? You probably never. So people with narcolepsy they basically fall asleep when they've been talked to you. So narco means it's usually sleep. But that's the word narcolepsy. All right, go to the next one. It's very fun. I feel like, everyone have a little bit of phobia. Okay, so anyone give me an example of phobia. There's so many phobia. There's phobia that I don't even know. Let's go 62.
Yeah, phobia means fear.
Okay.
And I know about photophobia means the fear of light.
Okay, photophobia, good. What about the fear of sound, like loud sound?
Loud sound?
Mm-hmm.
I don't know the terms for that.
Okay, so the term for sound is phono. So how would you add them up together?
Phonophobia.
Perfect. Anyone knows the fear of needle? There's a term for every fear. How about fear of height?
Acrophobia.
Good. Yeah, acrophobia. What about needle? Fear of needle. Is there a word for that?
Trypanophobia.
Huh?
Trypanophobia.
I don't know. We just call them needle phobia. It's a trick. Yeah. And we have a lot of patients that have fear of needle. We just call them needle phobia. We don't have a special term for it. Sorry, it's a trick for you guys, okay? Yeah. But literally, there's a phobia for anything. Photophobia, phonophobia, people with meningitis, we always ask them those questions, okay? Acrophobia, people who are afraid of, closed environment, there's a term for it. I'm sorry, it's so late, I forgot, and then you probably know, my mind is blank right now.
I forgot too. Yeah. I still remember aromaphobia. Yeah.
Let me look it up quickly. It's a tight space.
Excuse me. They have a, I don't know, it's trypanophobia. It's Germany fear of needle.
Okay, yeah. We just call them needle phobia. Claustrophobia, yeah. You know how people claustrophobic? Yeah. Claustrophobia is people who's very afraid of tight space. Okay. Yeah. All right. I mean, I'm not expecting you guys to know, structure of the brain. I think for me, I just want to walk you guys through, how do we know what central nervous versus peripheral, right? So central means the central part of the nervous system. And then peripheral means on the side, so anything on the side. So in our structures, the peripheral means that anything that beside the brain and the spinal cord, we call them peripheral. So like the cranial nerve, the spinal nerve root coming out of the spinal cord, we call them peripheral. Central is basically the brain and the spinal cord. So just remember that. I'm not going to ask you to, like, you know, say anything. A structure of the neuron, I think I'm just going to walk you through just how to, you know, pronounce them. I don't expect you guys to, again, remember the structure of the neuron. It doesn't serve you any purpose for you guys. For me, I don't even, you know, need to know these kind of things. So a neuron, which is a cellular part, like a building block of the brain, right? So when you talk about the brain, the building block of the brain is a neuron. When you talk about lungs, the building block of a lung is an alveoli, right? That's the building block. A building block of a muscle is, you know, a muscle cell, like a myocyte. So every system in the body have a building block, and for the brain, it's the neuron. So the structure of the neuron is you have a cell body, and sometimes the Latin term for it is soma, like, you know, soma is always body. And then you have the cell membrane, and then you have the dendrites. Remember, dendrites have the S at it, so you have to say dendrites, okay? And then you have the axon, is where they send the electrical systems, you know, signal through the axon, and it go all the way down to a axon terminal. So terminal means the end. So if you take somebody to the airport, they always say terminal A, B, C, you know, that's basically the end of, you know, of something. So it's axon terminal. It's basically where you transport something to a different space. So they always call it terminal. And then you have the myelin sheath. Remember sheath, okay? So this SH, so you have to say sheath. With the TH at the end, you have to pronounce the TH. Remember, put your tongue in between your teeth, so it's a sheath, okay? And then we have the node of Ranvier, and then we have the synaptic end bulbs, okay? So let's practice together how to say this word, all right? So let's say, does anyone want to try one word? What do we have? What is this structure of a what? Let's see. Okay, 25 Nhung Lê. What we have? Structure of a
structure of a neuron.
Okay, neuron. On, right? On. Yeah, neuron. Good. All right. And then let's see what's the next one? What is this?
Cell body.
Okay, cell body. All right. And what about this?
Cell membrane.
Cell membrane. Okay, perfect. All right, let somebody else take the other three. Let's see. Anyone want to volunteer, or I can pick? All right. Let's see. Number 7, Đỗ Thị Nga. What is this?
Dendritis.
Oh, okay. So let's go back. I know there's an ES at the end, but we don't say it as dendrites. It's not tis, right? It's no IS. So dendrites. Right? You want to say it again?
Yes, dendrites.
Good, perfect. Yeah. And remember the S, okay? Dendrites. All right. What about this one? You still have it. It's still you. Number 7.
Okay, so it's the swan cell? No, it's not swan cell.
So remember this is where they send the signal.
Also.
Yeah. What is it?
Axon.
Okay, so on, right? We can break it down. It's very easy. On, right? ON is on, right? What is A? Yeah, on. So axon.
Axon. Okay.
Yeah.
Axon.
No, you have to pronounce the X. It's very difficult because, you know, for us Vietnamese, it's very difficult to pronounce the X. So you have to pronounce it. So axon. Axon. Yeah, ax. So ax, you know, axon. Okay.
Axon.
Yeah. sir, like this S have to be strong, so axon. All right.
Strong.
Okay. All right. What about this one?
Swan.
There's two parts to it.
Yeah,
What is this name? Yeah.
It's a swan.
Okay. I mean, I take the swan, but what about, let's go back.
Myelin.
Okay. Myelin. Okay. And what's the other word?
Selves.
Yeah,
Swan.
that's perfect. Yeah. What about the thing on the outside? What do we call that?
Myelin membranes.
Yeah, I take myelin, myelin membrane, but what do you say? How do you say this word?
Myelin. No.
Yeah. No, there's a second word for it. There's the second word.
Yeah.
Myelin what?
Smiling.
Oh, you be very careful with the word.
I know that.
Because if you say it incorrectly, it could mean that you've been swearing at somebody. Okay. Okay. You hear it all the time, so that's why be very careful with this kind of word. Okay. So it's sheet, right? Remember.
Sheet.
So yes, if you say it very short, it become very bad. Okay. Like you swear at somebody. So first you have to prolong it. So she, right? So, and remember the TH, you have to put your tongue in between your teeth. So it's she. Okay. So it's right. Like she.
Yeah. Hùng ơi, could I say something about here?
Yeah.
Okay. First one, you have to remember this one is giống như là cái vỏ kiếm nè. Nó là cái vỏ của cái kiếm á, là cái nghĩa này. Nhưng mà there are three words you should practice because it's very, very difficult for the Vietnamese. Number one, shit. Cái đó là bẫy đấm phải không? Hai là cái tra giường của mấy em á, hay là tra giường trải cho bệnh nhân á, là shit. Mấy em kéo dài, một cái là shit, một cái là shit, đúng không? Shit. Cái này á là cũng giống như cái tra giường nhưng mà xem thêm cái chữ th phía sau nữa, shit, đúng không? Do đó nhà tập là không có tập chữ đầu tiên phải không? Nhưng mà tập cái chữ shit và shit.
Yeah, the TH is very difficult. So if you pay attention very closely, it's just you will hear the H at the end, is she, like like the th at the end. So just practice a little bit more. Okay. So myelin sheath. Okay.
Myelin sheath.
Sheath. No, sheath. TH. So when you finish the word, your tongue should be in between the teeth. Khi mà mình kéo cái chữ chữ th á, là cái lưỡi của mình nó phải ở giữa hai cái răng của mình, like teeth. Okay, teeth. See? Yeah, it's very different. Tại vì nếu mình không có bỏ vào á, là nó giống như là nó mắc đi cái chữ h. So you have to say sheath. Okay, like sheath. Cái lưỡi phải ở giữa hai cái răng của mình, like sheath. Okay. Sheath. Yeah. Kéo dài ra. Yeah.
You don't just go back to the basic pronunciation because you see the th in English, nothing similar in Vietnamese. Chữ th của tiếng Anh đó em không có phát âm cái gì mà giống tiếng Việt cả. Một cái là thick, một cái là the. Mấy cái đó đều để cái lưỡi ở giữa hai hàm răng. As Dr. Hùng said. Chứ không có, hoàn toàn không có giống tiếng Việt. Mấy em phải tập cái đó. Okay.
Yeah. Okay.
Myelin sheath.
Yeah, sheath.
Myelin sheath.
Perfect. Yeah.
Sheet.
Yep. All right.
Can I pronounce sheet?
Yeah.
Sheet.
As long as you have the th, like sheath, it's fine.
Sheet.
Yeah. Because if you just say sheet with the T, it's very different versus, yeah.
Sheet.
All right. Let's go for structure of the brain. I mean, I'm not even going to try to test you guys any of these. I think all of these are just good for, if you know how to say the word, it's just way too complicated. Okay. So we're just gonna walk together through how to say them, and then I'll say the word, and I ask some of you guys to repeat it. Okay. So the first one is the cerebrum. Okay. So cerebrum is the first one, and then the corpus callosum. That's the thick part in the middle, and then we have the diencephalon. Is a part of the midbrain, so we call it, it's the forebrain. I'm sorry, forebrain, and then we have the midbrain later on. But diencephalon, thalamus is the next one, and then hypothalamus. Remember, hypo means below, so that's why we have thalamus here, and then we have the hypothalamus, which is below it, and then we have the pituitary gland. Okay, pituitary, and then we have the brainstem. Is basically all of these are the stem. So brainstem is all of these parts. And then we have the midbrain, and then we have the pons. They have the medulla oblongata. It's very fun to say it. And then spinal cord. And then we have the cerebellum. Okay, so this is the cerebellum. Okay, so let's go back, and then we will have somebody say, all of them. Okay, and then more people practice, that will be better. Okay, this is your chance to practice. So I want to have somebody who haven't speak yet. All right, anyone? All right, let's say number 90. Did you speak yet? Damn, you've been.
Yes. The first is the cerebrum.
Okay. Okay. Yep.
And
all right, what's the next one?
The second is a corpus callosum.
Yeah, corpus, corpus, pus.
Corpus.
Yeah. Yep. Callosum.
Callosum.
Yep. Next one.
Diencephalon.
Good. Yep. Diencephalon. On. Yeah. Next one.
The next one is thalamus.
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 Good. Yeah, TH, not TA. So if there's only TA, then you call it thalamus. But if you have TH, then you have to say thalamus. Okay.
Thalamus.
Remember your tongue should be in between, right? Thalamus, right? Thalamus. Yep. Okay.
Thalamus.
Good. All right. Next one.
Hypothalamus.
Good. Perfect. Hypothalamus. All right. Next one. Slowly.
Pituitary gland.
Say that again. I'm sorry.
Pituitary gland.
Okay. Pituitary. Pituitary. Okay. Pituitary.
Pituitary gland.
Pituitary. Yep. Pituitary gland. Perfect. Okay. Next one.
Brainstem.
Stem. M.
Brainstem.
Good. Brainstem. Next one.
Midbrain.
Good.
Pons.
Yes.
Medulla oblongata.
Okay. Good. I mean, medulla oblongata, but it's hard. Okay. People say that, I don't know why would they make a word so difficult to say oblongata, Next one.
Spinal cord.
Spinal cord. Okay, good.
Cerebellum.
Good. Perfect. All right. All right. Next person. Let's do one more time.
May I try?
Yeah. Go ahead.
The first one, cerebrum.
Good. Cerebrum. Good.
Second, corpus callosum.
Okay. Try to repronounce the pus. Okay. Corpus callosum.
Corpus callosum.
Good.
Yeah.
Next one.
Diencephalon. Diencephalon.
Good. Diencephalon. On.
Diencephalon.
Good.
Thalamus.
Okay. Thalamus. Good.
Thalamus.
Yeah.
Hypothalamus.
Good. Perfect.
Pituitary gland.
Good. Yes. Slowly. Pituitary. See that slowly. Pituitary gland. Good.
Next one, brainstem.
Good. Brainstem.
Midbrain. Pons.
Good. You have the S at the end. Great.
Yeah. Medulla oblongata.
Yeah, I mean, even I can say so. You're probably better than me. So
Spinal cord.
Cord. Okay, good, perfect.
Cerebellum.
No.
Cerebellum.
Good, cerebellum. Okay. You see how just one word is it sounds different, right? Cerebellum versus cerebellum is very different. Okay. Let's have one more person say it. Anyone who haven't speak yet? Yeah, go ahead. Let's go back. Okay.
Cerebral.
Good, cerebrum.
Corpus callosum.
Good.
Diencephalon. Thalamus.
No, go back. Go back.
Diencephalon.
Good, diencephalon.
Thalamus.
Good, thalamus.
Hypothalamus.
Perfect.
Pituitary gland.
No, go back.
Pituitary gland.
So the emphasis is pituitary.
Yes.
Yeah, pituitary gland. Okay, it's not. So say that one more time.
Yeah, pituitary gland.
Okay, pituitary. Good. Next one.
Brainstem.
Okay, brainstem. Perfect.
Midbrain.
Good.
Midbrain.
Good.
Pons.
Good.
Medulla oblongata.
Perfect.
Spinal cord.
Good.
Cerebellum.
Cerebellum. Perfect. Yeah, I think you guys got it. Most of them, you know, the more you say, the better it is. The cranial nerve, I'm not gonna, it's ask you, so under already told you guys, it's just for reference. We're not gonna test you on this at all. I'm just gonna go through the 12, you know, cranial nerve and how to say them. But then I'm not gonna test you guys or ask you guys to say it, okay? So olfactory is basically the nose. Optic, I mean, that is the eyes. Ocular motor, motor is the motor, so it's, you know, to control the motor function. Ocular is part of the eye, so it's number 3 is to control some the motor movement of the eye, and then number 4 is trochlear. Okay, remember trochlear. Okay, and number 5 is trigeminal. Okay, so tri mean 3, right? Geminal is part of the germinate of the cell, so you know it's trigeminal, so it's have like 3 nerve branch coming out of it. And then we have number 6 is abducens. Remember it have the S, so abducens. Number 7 is facial, and then number 8 is vestibular cochlear nerve, and number 9 is glossopharyngeal. Number 10 is vagus. Number 11 is spinal, and then number 12 is hypoglossal. Okay, yeah. All right, so let's go through the some of the common abbreviations. Okay, so I think this is useful because, you know, when you see a lot of the medical record, so many abbreviations, and these are the abbreviations that are associated with the brain. So I'm trying to pick out the common one. Okay, so can someone tell me what AD that related to, you know, the brain mean, or give me the terms.
AD stand for Alzheimer's disease.
Okay, let's go back.
Alzheimer's disease.
Okay, so first is Alzheimer. Alzheimer. Yeah, Z, remember Alzheimer's disease. Okay.
Alzheimer's disease.
Yeah, Alzheimer's disease. Okay, and then what about ALS?
ALS.
L.
L stand for Meyer.
Very difficult. So let's break it down. Okay. So first, trophic, right? You can break it down. If you don't know anything, just say trophic.
Trophic.
Yeah.
Amyotrophic. Lateral.
Yeah. Amyotrophic. And then what is it?
Lateral.
Good. Lateral. Okay.
Lateral.
And then what's this?
Sclerosis.
Good. Sclerosis. Yeah, sclerosis. So let's put it together. Amyo.
Bên teo cơ.
Yeah. So amyo, right? Amyotrophic.
Lateral sclerosis.
Yeah, sclerosis. Okay. Slowly, your amyotrophic lateral sclerosis. Right?
Amyotrophic Lateral sclerosis.
Good, perfect. All right, let's see somebody else can pronounce it. Who raised your hand earlier? Let's go. Let's see.
Yes,
Let's
yes.
do
I
number
think
6. Yeah, let's do number 6.
yes,
Okay, now
it's
Mr.
the three term is the SC is the Caesar.
Okay.
Yes.
All right. Say that again for me.
Caesar.
Good, perfect. I like that. Seizure. Yep.
Yes.
All right, next one. What is that?
CP is the cerebral fancy.
No.
Fancy.
How do you say that? So let's go back. What is this?
Pauses.
Yes, pause. Yeah.
It mean you can movement the hand, the lamb is you can
Yeah. What about this? How do you say this word?
cerebral. Cerebral.
So where is the emphasis? In the middle, right? Right?
Yes, in the
Big
middle.
word. Yeah, so how would you emphasize the word in the middle?
Sarah and brain.
Yeah, but how would
Sarah
you
it mean the front of it.
Yeah, forget about what it means. I want you to pronounce the word.
Cerebral.
The word.
Cerebral.
Yes.
Cerebral.
Yeah.
Yes.
Cerebral, right?
Cerebral. Palsy. Cerebral palsy.
Yeah. So the emphasis is in the middle. Okay. So you could say cerebral or cerebral, right? It sounds very different. So cerebral palsy. Okay. So the emphasis is in the middle. Cerebral. Okay. All right. Let's go next one. Let's say number 70. Can you take the next one? Zhang Thi Huang Bin. What is CSF?
CSF. CSF means cerebral spinal fluid.
Okay. Okay. I'm sorry, I couldn't hear you. What did you say?
Cerebral spinal fluid.
Good. So I like that you put the emphasis in the middle, cerebral. Okay. So cerebral spinal fluid. Good. All right. You want to do the next one, EEG? Very different.
EEG. Electroencephalography.
Okay. Let's break it down so it's easy. Okay. So you can say electro, right? Electro, right? And then the next word is what? Encephalo, right? Yeah. Electroencephalography. See? So just break them down. So electrography and then encephalo. So you put all together, electroencephalography. Right? Say that.
Electroencephalography.
Yeah. Perfect. Okay, just do it slowly. No one is chasing you. So electroencephalography. All right. Let's do ICP. Who raised your hand? 46, Nguyễn Thị Tân Hiền.
So ICP is intracranial pressure.
Nope. Go back.
Intracranial pressure.
Yeah. So okay. So I like you have the intra is correct. It's cranial. It's not
cranial.
Yeah, crane. Okay, like
intracranial pressure.
Pressure.
Intracranial pressure.
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 Yeah. No sure. Like pressure. Good.
Pressure. Okay.
Yep.
Intracranial. Intracranial pressure.
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 Not sure. Okay. Pressure. When you say sure, is like up. Pressure. Like go down a little
pressure.
Bit. Good. Pressure.
Intracranial pressure.
Yeah. Cranial. Intracranial pressure. Okay. Not pressure. Pressure is go up. Like, all right. Pressure is go down.
Pressure.
Yep. Pressure. Perfect. Okay. Intracranial pressure. All right. Next one. LOC.
Next one. LOC is loss of consciousness.
Okay, go back. So I know you have the loss of. What about this? So
loss of consciousness.
Okay,
loss
so
of consciousness.
no, so it's this. Okay, consciousness is like ness. Consciousness, not ness.
Consciousness.
Yeah, ness. Yeah, ness. Consciousness.
Consciousness.
Yeah, conscious.
Loss of conscious.
Yeah, it's so difficult, but you know, so just break it down. Forget about the ness at the end. Just say conscious. Conscious.
Consciousness.
Good. Consciousness. Yes, you get in there. Okay? Slowly. Don't have to do fast. So conscious.
Loss of consciousness.
Yeah. Good. Perfect. All right. So let's have somebody else repeat those two words because I think it's a little bit difficult. So who raised your hand earlier? Okay. Let's say Anden, why you raise your hand? Anden, no.
No. I think I was 72, maybe you raised the hand a long time ago.
Yeah, let's do 72.
LP mean
yeah, let's go back to ICP.
ICP. Intracranial pressure.
I couldn't hear the other word. Say that again.
Intracranial pressure.
Good, perfect, very good. All right, LOC, more challenging.
LOC, loss of consciousness.
Okay, consciousness. Good. Yeah, I think I'll take that. Consciousness. Okay. Perfect. All right. Anyone else want to practice that word before we move on? Oh, no. All right, let's move on then. All right, let's see. Somebody else can do the last two. All right, I'm going to pick them.
14.
Okay, 14.
LP mean a lumbar puncture.
Okay, lumbar puncture.
Lumbar puncture.
Perfect. Yeah. How about MS?
MS mean multiple sclerosis.
Say that one again for me. I'm sorry.
Multiple sclerosis.
Okay, sclerosis. Sclerosis.
Sclerosis.
Okay. You missed the L part. That's why. Okay. All right. Multiple. It's multiple sclerosis.
Multiple sclerosis.
Good.
Sclerosis.
Perfect. Yeah, sclerosis. I have to have the. I need to hear the L. Okay, sclerosis. I have to have the L.
Sclerosis.
Yeah, sclerosis. Blur. I have to have sclerosis. Yeah.
Sclerosis.
So yeah, sclerosis, right? It had to have the L. Okay, perfect.
Yes.
All right, let's do some of the type of the skin lesion that we see. We kind of done with the brain now. We're gonna move to the skin, okay? And this is fun. This kind of be gross too. You see a lot of the skins, okay? So the first one is bulla. All right. So bulla it looked like a fluid-filled lesion. Okay, so we call it bulla. All right. So we go through all of this, and then we're gonna ask you guys to pronounce all of them. Okay. So we call it bulla. I like that word. It's fun to say. It's bulla. All right. Next one is when you have a skin crack. We don't say crack. We call it fissure. Okay, fissure, like pressure, fissure. Okay. You know, so that's kind of like a skin crack. Next one is macule. Macule means it's like a flat, sort of like a flat lesion. Okay, so that's why we call it macule. And then if you have a raised lesion, then we call it a nodule. Okay, a nodule. All right. And then papule is when you have, it's a little bit smaller than the nodule. Okay, but it's still raised. So we call it papule. And then a plaque. Okay, plaque is like a very big patch, like more than 1 centimeter. So we call it a plaque. And then pustule. Okay, pustule. Remember the pus, right? Pus is basically it's like it have pus in it, so that's why they call it pustule. And then vesicle is like fluid fill. It's not like bulla. It's a little bit smaller, so that's why we call it vesicle. If it's multiple one of them and it's more than 1 centimeter, then we call it bulla instead of vesicle. And then this one is the will. This is an allergic reaction. It's like a skin raised, and we call it a will. Okay. All right. So let's have somebody pronounce all of the lesions. All right. Who want to go first? Raise your hand. All right. Let's get number 83. I haven't heard from you, so that's good. Nguyễn Quế Trần.
Yeah. So the first one is polar.
Okay. Bowler.
Polar.
Good.
Fisher.
Fisher. Perfect. Yeah.
Macular.
Nolar. Macule.
Macule.
Yeah.
Macule.
Yep.
Nodule. Nodule.
Nodule.
Nodule. Yeah.
Yeah.
Nodule. Papule. Papule.
Nolar. Remember, it is papule. Just one. Macule, papule, nodule.
Yeah.
There's no lur at the end. Yeah. Okay.
Papule.
Yeah, papule. Good.
Black.
Black. Good. Yep.
Pustule.
No, P, you have to say the P is different. Pustule.
Pustule.
Yeah. Good. Pustule.
Physical.
Nope.
Physical.
No. Nope.
Vehicle.
Vesicle.
Vesicle. Yeah.
Good.
Thank you.
All right.
Will.
Perfect. Okay.
Yeah.
All right.
Thank you.
Who else? All right. Who else? Let's see. You already did.
For me, 61.
Okay. Who's speaking? I'm sorry.
Yes, I'm 61.
61. Okay. Let's go. Number one. First one.
Yes. Purple.
Huh? No.
Purple.
No. So let's say it's a B, right? It's bowler. 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 There's no lur. There's no R. So you can just say bowler. Bowler.
Bowler.
Yeah. Bowler.
Bowler.
Yeah. Bowler.
Bowler.
Good. No lur. No there's no R. So you don't have to curve. You don't have to twist your tongue. It's bowler.
Bowler.
No, you twist your tongue a lot. You're twisting your tongue. It's bowler. La.
Bowler.
Let me where's your
Bowler. Fisher.
Okay. Yep, Fisher.
Fisher.
Okay, good.
Marco.
No, macule.
Macule.
Yeah.
Macule.
Yep.
Noodle.
It's not noodle, it's nodule.
Nodule.
Yeah, nodule. Okay.
Nodule.
Yeah.
Purple.
Nope. Papule. Eel.
Papule.
Yeah, so macule, papule.
Papule.
Yep. About this?
Black hole.
No. There's no goal. There's plaque. Just a plaque.
Black hole.
Good. Just plaque. No, there's no goal. Plaque.
Black.
Yeah. No goal, okay? Plaque.
Black.
Yep. Perfect.
Pustule.
Say pus. Yeah, pustule.
Pustule.
Okay, pustule.
Pustule.
Yeah. Okay. Say that again.
Vesicle.
No, the sure is very strong. There's no H. Okay, it's just vesicle.
Vesicle.
Yeah, vesicle.
Vesicle.
Yeah, vesicle. Okay.
Vesicle. Wheel.
Yep. Yep. Wheel. Yep. Vesicle. Wheel. Okay.
Vesicle. Wheel.
Good. Yeah. There's no sh, so you can't say vesicle. Okay, it's not shico. It's C. So vesicle.
Vesicle.
Yeah, not vesicle. Good. All right. Perfect. Yeah, keep practicing. Try not to curve your tongue too much. Okay. There's the only time that you curve your tongue is when you have an R. That's when you really should curve your tongue. Okay. Everything else is just natural. All right. Who else want to try?
Teacher, can I try?
Yes.
First, polar.
No. It's a
Polar.
it's a B. It's a B. So boy, right? Boy. Bowl. Yeah.
Bowler. Bowler.
Yep.
Bowler.
So when you say
Bowler.
when you guys say lur, it's like going up, right? It's bola. It's a. It's a, right? It's a. So it's bola.
Bowler.
Good. No bowler. Like is go up. A.
Bowler.
Yeah,
Bowler.
bowler.
Fisher.
Yeah,
Fisher.
fisher. Yeah, fisher.
Fisher.
This one you go up. Yeah, fisher. Good.
Macule.
Yeah, that's fine. Macule.
Macule.
Good.
Nodule.
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 Nodule. Yeah,
Nodule.
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 Yeah.
Nodule.
Good. Nodule.
Papule.
Good. Papule.
Black.
No, you say
Black.
that's a color. The B and the P is very different. Okay, so P versus B. Yeah. So
P.
this is black. Okay.
Black.
Yeah, not black. Black is the color. So is the bird is very different. So plaque. Good. Plaque.
Black. Black.
Plaque. P. Say P. Plaque.
P. Black.
Good. All right.
Pustule.
No.
Pus.
Pus. Good. Pus.
Pustule.
Yeah. Pustule. Good.
Pustule.
Kind of like this. Nodule, right? Pustule. Right?
Pustule.
Yeah, it's the same. Nodule. Pustule. Okay.
Sure.
Yeah.
Vesicle.
Good. Vesicle. No, there's no Why? Don't twist your tongue. Vesicle. Oh.
Vesicle. Vesicle. Vesicle.
Oh. Yeah. Vesicle.
Oh, vesicle.
No. There's no There's no R. There's no ER at the end. Just vesicle. Oh.
Vesicle.
Oh. Yeah. Vesicle. Good. Vesicle.
Will.
No. Will.
Will.
No, you don't have to curl your tongue. Just will.
Will.
Just
Will.
will. Yeah. Will. There's no Okay. Just will. Will. Good. No
Will.
Okay.
Thank you, teacher.
Yep. All right. Let's see. Okay. Let's go next. So I think this one is, and then probably knows a lot about this. You know, if you work in the hospital, this is probably one of the most difficult, skin lesion that you have to take care. Okay. So it's the pressure ulcers. Okay. So these are, sometimes we call them bed sores. And they have different stage depending on how deep they go. Okay. They have different stage. They have, the skin, the fat underneath, and then they have muscle and to the bone. If they only affected the skin, then we call them stage 1. It affects a little bit more deeper than the hypodermis, then we call stage 2. It is affecting the fat, then we call stage 3, and they start eating everything else, then we call stage 4. Okay, so this is pressure ulcers. Okay. All right, let's go through some of the common skin disease. And I'm just going to ask you guys to pronounce it. Okay, I think there's no point to know the difference between them, but these are common. So let's go through them together. All right, let's have you number 44. Can you say the first one? 44, Nguyễn Thị Ngọc.
Atopic dermatitis, eczema.
Okay.
Dermatitis.
Okay, so let's go back. Okay. So what is the last word? What is the root? I mean,
dermatitis.
What is itis?
Dermatitis.
Yeah, so you're missing a lot of the words. So itis is inflammation, right?
Itis.
Yeah. So this is dermatitis.
Titus. Dermatitis.
Yeah, so dermatitis. Okay.
Dermatitis.
Good. So dermatitis.
Dermatitis.
Yeah. So we remember always put the pressure on the itis, right? So dermatitis, right?
Dermatitis.
Yeah. Always. You can always say dermatitis, right? Yeah, always itis. Yeah. All right, next one.
Eczema.
Good. So eczema.
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 Eczema. Eczema.
Good. Next one.
Erythema.
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 Yeah, erythema. Good.
Erythema.
What's the next one?
Melanoma.
Okay, so
Melanoma.
yeah. Now go back. Noma, melanoma. Melanoma. So melanoma. Yeah.
Melanoma.
Yeah. Melanoma.
Melanoma.
Okay.
Melanoma.
Yeah. So slowly. You don't have to say it really fast. Just say it very slowly. Melanoma. Okay.
Melanoma.
Relax. Right. Just relax.
Melanoma.
Good. Melanoma. All right. What's the next one?
Acne.
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 So try to accentuate your word a little bit longer. Okay. You tend to be very short. So acne.
Acne.
Good.
Acne.
Good. So I have to have the cut. Acne.
Acne.
Good. All right. Next one.
Onsbinzi.
Try, but a good try, but let's try go back. Okay. Ism, right? Albinism.
Albinism.
Yeah. Albinism.
Albinism.
Nism. Knee.
Albinism.
Good. So
Albinism.
albinism. Okay. Next one.
Albinism.
Next one.
OPC. OPC.
Nope. Let's go. Alopecia. See that?
Alopecia.
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 She. Alopecia. See SH. Alopecia.
Alopecia.
Good. All right. Next one. Remember itis.
Folliculitis.
Nope. Folliculitis.
Folliculitis.
Yeah. So folliculitis. Okay.
Folliculitis.
Good. Yeah.
Folliculitis.
Yep. This one.
Furuncle.
Furuncle. Yeah. Furuncle. Okay.
Furuncle.
Good. What about this?
Rosacea.
No. Rosacea. No. Rosacea. Rosacea. So is it rosacea?
Rosacea. Rosacea.
Sure. No. Rosacea.
Rosacea.
No. She. He. Rosacea.
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 No, so this is an R, so it's row, not no. Rosacea. Yeah,
Rosacea.
Okay, just slowly. Just repeat slowly after me. Rosacea.
Rosacea.
Yeah, like he, right? He, she, right? So rosacea. Good.
Rosacea. Rosacea.
Good. Next one.
Scabies.
Okay, that's fine. Scabies.
Scabies.
Yeah, scabies.
Scabies.
Yeah. Next one.
Vitiligo.
Oh. Yeah. Let's go. Vertigo.
Vitiligo.
Vertigo.
Vitiligo. Vitiligo.
Lies. Vertigo.
Vitiligo.
Yeah. Okay. Next one. So this one is see? This is everyone's favorite. You always have the So carrier. Yeah. Urticaria.
Urticaria. Urticaria.
Good. Urticaria. Good.
Urticaria.
Good. Just try when you speak, just do it slowly. Okay. You don't have to speak really fast, just slowly. Okay. Like urticaria, dermatitis. Try as slow as you can. Okay. You gotta slow down. Try as slow as you can. Okay.
Okay. Thank you, doctor.
Very slow. Yeah. That's my advice to you. Very slow. All right. Who's next?
May I try, please?
Okay.
Okay. Number one, dermatitis.
Good.
Eczema.
Good. No, eczema. There's no
Eczema.
Yeah, eczema.
Eczema.
Yeah,
Eczema.
Good.
Erythema.
Nope.
Erythema. Erythema.
Right?
Erythema.
Good. Erythema. Thema. Yeah, erythema.
Erythema.
Yep, good.
Melanoma.
See, so I there's no right? Right?
Okay, sorry.
There's no
Melanoma. Melanoma.
Good. Perfect.
Acne.
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 Good. I have to see the like acne.
Acne.
Good.
Abysm.
It's albinism.
Albinism.
Good.
Albinism.
Good.
Alopecia.
Perfect. Alopecia. Good.
Folliculitis.
Perfect. Yeah.
Furuncle.
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 Yeah.
Rosacea.
Rosacea. No
Rosacea. Rosacea.
Rosacea.
Rosacea. Rosacea. Right. Rosacea.
Yep. There's no The word rosacea.
Rosacea.
Good. Yep.
Scabies.
Scabies.
Scabies. Vitiligo.
Yep. Vitiligo. Vertigo.
Vitiligo. Urticaria.
Nope.
Urticaria.
You guys always say the R at the end. It says yeah, urticaria.
Urticaria.
Yeah. See, when you guys need to twist your tongue, you don't. But when you don't need to, you guys always twist your tongue. All right. So it's urticaria. Okay. Perfect.
Okay. Thank you.
Yep. All right. One more person. Oh man, I'm hungry. Who else?
Can I try?
Who is this? Yeah, go ahead.
It's
Which number are
dermatitis.
you? I'm sorry.
It's number 7.
Okay, number 7. Good. All right, let's go.
Okay, it's dermatitis.
Okay, go back.
Dermatitis. Atopic dermatitis.
Dermatitis. Good.
Dermatitis. Eczema.
Eczema. Good.
Erythema.
No, try it again. Slowly.
Erythema.
Thema. Yeah. Erythema.
Yeah. Melanoma.
Good. Perfect. Slowly. Good.
Acne.
Acne. Have the K. Acne.
Acne.
That's fine.
Albinism.
No.
Albinism.
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 Yeah.
Albinism.
Yep.
Alopecia.
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 Good.
Folliculitis.
Nope. It's itis. There's no itis. Okay.
Yeah.
Always itis. Yeah.
Folliculitis.
Yeah.
Itis.
So say that again.
Folliculitis.
Good. Yeah. Always itis. Okay. No itis.
Okay.
Mm-hmm.
Furuncle.
Perfect.
Rosacea.
No. Rosé. Sha.
Rosier.
No, sha. Remember she, he, she, right? He, she. Yeah, rosacea.
Rosacea.
No, rosacea. Sha.
Rosacea.
Yep. No, there's no seer. There's sha, like sha.
Sure.
Yeah, you know, like sir, but instead of this sir, we sha, like rosacea.
Rosacea.
Okay, good.
Scabies.
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 Good.
Vitiligo. No.
Okay, yeah, I take that. Vitiligo, yeah.
Vitiligo. Urticaria.
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 Good. All right. Yeah, I mean, those are very tongue-twisting one. It's difficult, but I think you guys got it. Okay, let's end the lecture with some fun game, okay? So you guys know the abbreviations, but I want you guys to match the definition with the right abbreviations, okay? So let's pick who haven't spoken yet. Let's number 73. I haven't heard you speak, so let's go. Number 8. Let's match. What do you think match with A?
Okay.
Yeah. Say the thing for me. Read the thing.
SR mean seizure.
No, A. I want you to match what in the A. Okay, so what's A?
Fluid is found within the tissue that surrounds the brain and spinal cord. Let's go with CSF.
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 Okay, what is CSF?
Cerebral spinal fluid.
Okay, so cerebral. Okay, cerebral
spinal fluid.
Good, perfect. Yeah. All right. Good. You got it right. All right, number 83. Nguyễn Quế Trần. Let's do B. Read B for me.
So, make up the brain of the and spinal cord means
Go back.
CNS.
Hang on. When I say you say make up, there's no K, right? It's made up. It's D. Yeah, made up the brain and the spinal cord. Okay.
Yeah, made up of the brain.
Made up, not make up.
Yeah, made up.
Yep.
Of the brain and the spinal cord means CNS. That means the central nervous system.
Okay, go back. Central nervous
system.
Good. Yeah. Slowly. Nervous system. Okay. Every word counts. So don't swallow the S. So nervous system. Okay.
Central nervous system.
Yeah. Nervous. Yeah.
Nervous system.
Yep. Slowly. Good. Yep.
Yeah.
All right. Let's see who will raise your hand. Nhung Lê, 25.
Yes.
C.
A procedure to record the electrical activity of the brain is EEG, electroencephalography.
Good, perfect. Let's go back to read C. Okay, it's how do you say that? This word.
A procedure.
A procedure.
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 A procedure.
Just see. There's no proceed, like procedure.
Procedure.
Good. Yeah. Procedure to record.
Record the electrical activities of the brain.
Good. Perfect.
EEG.
All right. EEG. Perfect. All right. So electroencephalography, right? Good. All right. Who want to do next one? Let's see. Nguyễn Hoàng Lang, 14. Let's go D.
A raise in the pressure inside the school.
Okay. I'll let you answer first, and we can go back. Okay. So let's go back first, actually. So speak the sentence again for me.
A raise in the
go back. It's not a race. It's a rise, right?
A rise. Yes.
Yeah, race mean the other one. Race mean ISE. Yeah.
Okay,
This
okay.
is a rise in
A rise in the pressure.
pressure. Yeah.
Inside the school.
Skull. Oh,
School.
yeah.
School.
Oh, yeah. When you say school, let's mean the school. Like, you know, when the student go to school. Okay. This is a skull. Oh.
Skull. Skull.
Yep. Perfect. Skull. Okay. What is it? What's the answer?
ICF. ICP. ICP.
ICP. What's ICP?
ICP means intracranial pressure.
Yes. Good. Very good. See, you speak very slowly and it's perfect. Okay. Intracranial pressure. Okay. Perfect. All right. Let's see who want to try the next one. Phạm Thị Văn Anh, 59.
So
Let's
the
do
next
the-
one is a medical procedure.
No.
In which
No. A medical
procedure.
Yeah.
In which a needle is inserted
Inserted?
into the spinal canal.
Canal. Good. Spinal canal.
Spinal canal.
Okay.
Yeah. So it equivalent to the lumbar puncture. LP.
Good.
Yeah.
Very perfect. Lumbar puncture. Good. You guys are very good. Okay. Who want to do the next one? Let's go number 60. Phạm Văn Bảo. Let's do F.
A black out or a syncope. It means I don't have an answer for me.
You don't have an answer? Yeah. Can you can phone a friend who can help him out?
Okay.
Who can help? Who can help him out?
Loss of consciousness.
Perfect.
LOC.
Okay. So say whoever speak, can you say the word again for me?
Okay, I say it again. Loss of
Yeah.
consciousness.
Consciousness. No, just
Consciousness.
good. Perfect. So conscious and then just add the ness at the end. Consciousness. Okay. Yeah. All right. Number 30. Can you say that word? Since you didn't have the answer. So what's LOC? Where's number 30 go? Oh, number 60. Phạm Văn Bảo, you want to speak it? Just repeat the LOC.
Okay. LOC is loss of consciousness.
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 Good. So consciousness. Yeah. All right. Who want to do the next one? All right. Let's go. Nguyễn Thị Dung, 40. Nguyễn Thị Dung, you there?
Sorry, I
That's okay.
lost my board.
That's fine.
Yes. The G is a brief stroke line attack.
Okay,
It's
good.
TIA transitions ischemia attack.
Okay. So let's go back a little bit. You got it correct, but it's transient.
Transient.
Yep.
Transient.
Remember the T. Don't forget the T. Transient. Okay. Transient.
Transient.
Yep. Ischemic.
Ischemia attack.
Ischemic.
Ischemic.
No, ischemic.
Ischemic.
Good. Ischemic attack.
Attack.
Good. Remember the K, okay? Don't forget it. Ischemic attack.
Oh, yes, thank you, sir.
Yep. All right. Let's do H. All right. H. Who's raising your hand? Using my brain power. 7 Đỗ Thị Nga. 7.
Unmute.
I mute my micro. So it's a brain disorder
Nope, go back. What is that? H?
It mean SE,
Yeah,
season.
H. Yep. So go back. Yeah, read the thing for me.
I read all the sentence.
Yeah.
Okay. A brain disorder that slowly destroys the memory and thinking skill.
Okay. You missed the S at the end of the skills. Skills. Yeah, don't forget them, okay? Yeah.
Okay.
What is it?
It's a scissors.
No, we already have a seizure. Is that a seizure?
Oh no, I'm sorry. It's AD. It's AD.
Yeah, what's AD?
It's a Alzheimer disorder. Alzheimer
Okay.
disease.
Alzheimer. Alzheimer, not okay. Alzheimer.
Alzheimer disease.
Yeah. Yep. Alzheimer disease. Perfect. Okay. All right. Let's have number 91. I think she raised her hand earlier. 91. Can we do the next one? 91. Yep.
Sudden uncontrolled electrical disturbance in the brain.
Okay. Let's go back a little bit. You have sudden.
Sudden.
Yep. Uncontrolled.
Uncontrolled.
Yep. What is it?
Electrical.
Electrical. Perfect.
Disturbance.
Yep. Disturbance. Yep.
In the brain.
Perfect. Yeah. All right. What's the answer?
That is seizure.
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 Yes.
Yeah.
Perfect. Very nicely done. All right. Who have the last one? We're gonna end the class. All right. Who want to be the last person?
I think I 72 because I saw him raise her hand a long time ago.
Okay, 72. All right, 72.
And
Jay.
made up of structures lie outside the brain and the spinal cord.
Yeah, perfect. Yeah, very nicely done.
PNS.
All right, what's PNS?
Peripheral nervous system.
Okay, perfect. So peripheral nervous system. Okay. Yeah, very nice. You guys are very good. Okay, I think that will be the end. And just want to say Happy New Year to all of you guys. I'm super hungry. I'm tired. It's a long day at work for me. Doesn't anyone want to say anything or want to go practice anything, before we end the class?
Before everybody can say something to Dr. Hung, I would like to say very thank you to you. Okay. Yeah. And you already have finished your missions anyway. It's the last session of Dr. Hung. And if somebody like to see him for the next course, he will be there for you. Okay.
I did not have to haunt me for the lectures, I'm always so behind. Yeah. All right. Yeah. Anyone want to say anything or want to share anything before we end the class?
Mm-hmm. Thank you and have a good meal.
Okay.
Thưa thầy, em muốn hỏi về cái bài test thứ hai ạ. Thì em muốn hỏi là theo lịch thì là hôm 11 tháng 2 là mình sẽ làm test hay là 11 tháng 2 là em thấy ghi có cả lịch của bài học thì em chưa hiểu là học xong mình sẽ làm test hoặc là như nào ạ?
Ok, bây giờ những câu nào mà mấy em muốn nói với bác sĩ Hùng trước đi ha, rồi cái test hay gì á, sau khi bác sĩ Hùng rời ở đây để đi ăn cơm thì chúng ta sẽ nói có thời giờ nhiều hơn. Ok nha. Tôi sẽ trả lời em. Ok.
Yeah. Phải về sớm mà 11 giờ đi, kiểu này buồn ngủ.
One day, Happy New Year to all of you.
Thầy Hùng chào bác sĩ rồi.
Yeah, wish you have a good health, lucky, and healthy.
Yeah.
Every day.
Thank you guys. Thank you. And I think this class is very good. Okay, it's not just for medical doctors, but for everyone, right? Pharmacists, physical therapists, pretty much everyone. And I think now that medical field has advanced a lot, I think that we need to speak English a lot more. And the more we speak English, the more you guys gonna learn. And there's so much to learn, and it's really fun. And I think you should pick a person that you have a good relationship with and talk to them. Just talk in English. Okay. When I first came to America, I always, talk to myself in front of the mirror. It's, sounds crazy, but, you just have to really practice over and over and over again and again. Slow down. Don't speak really fast. Just really try to speak correctly. And once you get that, and then, things will get easier. Okay. But try to find some foreign friends or even Vietnamese friends and just talk to each other in English. Okay. Best of luck to all you guys. And then thank you.
Okay. Thank you very much, Dr. Hùng.
Happy New Year, okay, and then.
Okay, Happy New Year.
Bye.
Bye.
So much.
Okay. Rồi, bây giờ thì chúng ta nói tiếng Việt phải không? Thì trước khi mà nói về cái thi kỳ 2 đó em, thì tôi xin nói lại một chút xíu về ngày hôm nay là chúng ta học được 9 buổi rồi phải không? Thì tôi có một số nhận xét như thế này. Mấy em học về từ ngữ, về cái thuật ngữ thì rất là tốt, nhớ rất nhiều, kiến thức rất nhiều, nhưng mà mấy em cũng còn sót lại là cái phát âm nó chưa được chuẩn lắm, hầu như là nhiều người lắm chứ không phải là một vài người. Do đó mấy em phải, tôi không biết như thế nào, tại như thế này, mấy em hoặc là mấy em vào trong cái cuốn từ điển á, có cái từ điển mà trên mạng á, mấy em nghe cái phát âm lại, tại vì phát âm mà mình không chuẩn á, tới chừng mình nói chuyện với đồng nghiệp của mình, người nước ngoài, hoặc là mình nói chuyện với bệnh nhân á, là họ không hiểu. Dĩ nhiên là bệnh nhân thì không có dùng những cái thuật ngữ nhiều, nhưng mà đối với đồng nghiệp của mình á, họ sẽ không hiểu. Giờ mấy em cố gắng phát âm ở đây. Tôi thấy như thế này, có những cái điểm mà mấy em thường bị sai nhất. Một là stress, phải không? Lên xuống ha. Hai á, là chữ bờ và chữ pờ. Ha. Cái đó là hai cái phát âm nó hoàn toàn khác nhau. Không nói đến chữ th, chữ th của tiếng Việt mình đó là hoàn toàn khác nhau. Tôi ngày hôm nay không đủ để luyện cho các em cái đó, các em sẽ tìm. Đó là những cái tiếng, cái môn Anh văn cơ bản, chứ không phải là về cái y khoa, nhưng mà mấy em phải cần ôn lại những cái phát âm cơ bản đó. Còn cái chuyện là như hồi nãy bác sĩ Hùng nói đó, mấy em cố slow down là đúng rồi ha, nhưng mà mấy em cố tách ra từng âm một. Tại đó có cái phiên âm đó, mấy em tách ra từng âm một, mấy em phát âm cho nó đủ, đừng có skip. Nhiều em nhảy cái âm lắm, tại vì mỗi em sẽ thấy những cái nguyên âm á, là mình phải phát âm từng âm một, sau đó mình mới ráp lại và mình nói cho nó thật nhanh lên, thì lúc đó thì nó sẽ đỡ hơn. Đó là cái ý kiến của tôi. Thì bây giờ đúng ra đó, trước đây tôi có thì giờ có những buổi ngoại khóa, mấy em nào mà thấy là cái phát âm của mình không có được hay lắm, hay là mình nghĩ là mình không được lắm, thì cứ message cho tôi, và có cái giờ rồi đó thì tôi sẵn sàng tôi bỏ ra cái thì giờ đó cho riêng em đó, hay một vài em gì đó, để mà tập lại phát âm cho nó trúng. Tại vì từ đây cho tới cuối khóa là còn vài ba tuần nữa thôi, mấy em phải cần luyện lại cái này cho nó tốt đó. Đó là cái thứ nhất. Cái thứ hai, tuần sau thì là Dr. Win sẽ nói về oncology, là về ung thư á. Thì tới giờ tôi cũng cho các giảng viên bác sĩ họ rất là bận, lần nào cũng hối thúc để cho các em các bài handout đó, nhưng mà người ta ráng làm rồi, nhưng mà một số em lại không có xem cái handout nữa. Như vậy thì tôi đâu có cần đưa cái handout các em trước là làm gì, đúng không? Đưa cái handout trước cho mấy em để mấy em coi sơ qua, mấy em hiểu được thì vô cái buổi học mình sẽ lẹ hơn, sẽ nhanh hơn. Thứ nhất mấy em ráng cho tôi những cái handout hầu như là có những cái phát âm đó, thì mấy em ráng phát âm, tập cái phát âm cho nó trúng. Thì cái giờ giấc của mỗi người chúng ta sẽ ngắn hơn, chúng ta sẽ được nhiều người nói chuyện hơn. Đó. Rồi bây giờ trước khi vào cái kỳ thi á, mấy em có ý kiến gì nữa không trước khi tham gia vào kỳ thi, về những cái gì mà về kỳ thi? Có em nào có ý kiến gì nữa không? Còn không thì giờ chúng ta vào nói về cái thi. Rồi thì như nào, hồi nãy em nào đó hỏi về cái giờ giấc phải không? Có em nào không? Hồi nãy nói.
Em hỏi ạ. Lúc nãy thì em có hỏi là em nhìn theo lịch thì cái hôm mùng 4 tháng 2 mình sẽ học về oncology và midterm, thì em muốn hỏi là cái midterm đấy là mình sẽ làm sau khi mình học cái oncology, nghĩa là sau 11 giờ.
Không, cái hôm trước tôi đã ghi trên Facebook cho em rồi. Cái midterm đó tôi sẽ để cho cái tuần học mà 11 đó là gynecology đó. Tại vì như sao? Tại vì cái midterm 2 này mà em có 4 bài. Nếu mà bắt mấy em thi ngay cái bữa và sau oncology đó là mấy em có 3 bài thôi, đúng không? Chứ đâu tôi không thể nào mà hỏi em là cái mấy em mới học xong mà tôi hỏi lựa được. Mấy em phải không? Do đó đó là 4 bài đó thì như vậy tôi ghi như thế, nhưng mà tức là cái buổi sau nữa đó mình phải thi, học xong cái buổi sau của đâu với lại Dr. Minh Đỗ á, thì mình sẽ thi. Nhưng mà thi như thế nào, mấy em muốn thi liền hay cho ngoan một vài giờ, hay là cho thi trước đó một buổi một ngày, hay thi sau đó một ngày, đó là tùy mấy em. Nhưng mà nói chung á, phải để cho xong cái oncology của Dr. Win xong, để mà ít nhất cũng phải là 5-6 ngày nha, rồi tôi mới hỏi các em. Tại vì sẽ hỏi những cái câu hỏi trong đó nữa. 25 chúng ta cũng kỳ này chúng ta cũng có 25 câu hỏi, thi cũng giống y như kỳ trước vậy. Bật cái link lên là mấy em vô thi, hầu như là mấy em đạt hết, hầu như là mấy em đều có điểm rất là cao. Thì thi cũng kiểu tương tự như vậy, nhưng mà nội dung khác thôi. Mấy em có ý kiến sao? Thì ngay hôm sau khi mà nói đi em.
Em muốn hỏi là thì mình có thể, có nghĩa là sau khi mình học cái bài section 10 ở oncology một vài ngày thì mình thi có được không ạ?
Đúng
vẫn
rồi.
trước cái thì bởi vì là nếu mà thi vào cái hôm mà học buổi 11 tháng 2 ấy, thì sau khi học thì thi thì em nghĩ là nó hơi kiểu như là buổi trưa quá các thứ, thì sau khi học bài oncology thì trong cái tuần đấy thì mình thi vào một hôm nào đấy thì được không ạ?
Đó là do về tùy mấy em ý kiến đi. Yeah.
Không nhất thiết là phải thứ bảy ạ. Bởi vì thứ bảy mình đã có một bài học section 11 rồi ạ.
Nhưng mà làm sao mà mấy em rảnh hết? Tại vì thi đó thi một lượt, không thể nào là người này thi ngày này, người kia thi ngày kia, phải không?
Thế ơi, em có ý kiến đâu ạ? Cái hôm ngày 11 đấy ạ, sau khi mà học xong cái bài đấy ấy, thì em nghĩ rằng là đến ngày 18 là mình vẫn tiếp tục học, 18 là vẫn vào thứ bảy của tuần sau ấy ạ. Thì trước khi mà bắt đầu buổi học đấy thì mình sẽ dành 30 phút để thi được không ạ? Tại vì là cái bài midterm 1 ấy, em thấy thầy cũng chỉ dành cho 30 phút để thi thôi. Thì em nghĩ là trước cái bài học 18 mình sẽ thi, tại vì là thứ bảy tất cả mọi người sẽ được nghỉ. Mọi người đều học ấy, có nghĩa là ngày trong tuần thì có thể là mọi người sẽ đi làm hoặc là các bác sĩ sẽ trực ấy, thì em sợ là mọi người sẽ không tham gia được vào cái ngày đấy.
Cũng được.
Được không ạ?
Ví dụ như lớp chúng ta bắt đầu là 9 giờ phải không?
Dạ vâng, thì hôm đấy có thể là bắt đầu 8
tôi
rưỡi.
đề nghị là 8 giờ. 8 giờ rưỡi thì nó cận quá, sát quá, đúng không?
Dạ vâng.
8 giờ. Tại vì 8 giờ đó, ở đây là mấy em ở trong nhà không, chứ mấy em đâu có đi lên vô lớp học đâu. 8 giờ mấy em bật lên. Thí dụ như vậy. Thì thi xong là tới 8 giờ 30 đâu đó đó, chứ mà 8 rưỡi tới 9 giờ thì nó hơi cận quá. Tại vì tôi còn phải kết thúc cái program đó nữa, phải không? Thì cũng một vài phút, để dành cho em một vài phút để mà chúng ta chu toàn cái bài thi. Các em thấy thế nào, được không? Như thế thì 8 giờ cái buổi
8 giờ ngày 11 tháng 2 ạ.
Rồi Phan Văn Bảo ngáp rồi.
8 giờ ngày 18 chứ chị ơi. 8 giờ ngày 18
sau khi học xong bài ôn cô đã.
8 giờ ngày 18 tháng 2.
8 giờ ngày 18 á, là tức là không em. Đúng là 8 giờ ngày 11 đúng hơn chứ. Tại ông cô đó là ngày 4 mà.
Ý thầy là đúng rồi, ý thầy là mình sẽ chỉ thi 4 bài, là từ bài 7, bài 8, bài 9, bài 10 thôi, thì mình sẽ thi vào một trong những ngày mà sau khi học bài 10, có nghĩa là chậm nhất là ngày học bài 11 rồi.
Đúng
Nếu
rồi,
mà thi thì phải thi vào 8 giờ ngày. Đúng rồi. Ý thầy là như thế thì sẽ phải là thi vào 8 giờ ngày 10.
8 giờ có ai còn ngủ không? Có ai chưa thức vậy đó, vậy chúng ta đồng ý. Về nội dung thì thật sự ra tôi vẫn còn truy kích mấy giảng viên để hỏi những cái câu đặt cho mấy em, thì hiện nay thì có một số rồi nhưng mà chưa có đầy đủ lắm, nhưng mà do đó tôi không có thể nói là nội dung gì, nhưng mà hy vọng là sau khi mà Dr. Win giảng cho mấy em xong á, thì tôi có một số nội dung thì tôi sẽ hướng dẫn cho mấy em biết cái chỗ nào. Thí dụ ngày hôm nay thì chắc chắn là chúng tôi sẽ không hỏi về các tên của các dây thần kinh sọ, là chắc chắn rồi, không cần hỏi đó. Nhưng mà những cái gì thì tôi sẽ bữa kỳ tới tôi sẽ nói mấy em. Ok, gì nữa không? Vậy là xong phải không? Tôi tóm lại ha, cái mong muốn của tôi nhất á, là nghĩa là mấy em rất là khá về kiến thức về thuật ngữ, tôi không có gì lo lắng lắm, nhưng mà lo lắng nhất của tôi là cái phát âm sao cho nó đúng, cho nó chuẩn. Cái đó là tại cái phát âm trúng, không cần phát âm nghĩa là như người Mỹ người Anh ấy, nhưng mà phát âm làm sao cho người ta hiểu. Khi em nói cái câu đó mà tôi hiểu á là ok, hiểu không? Đó là cái ok rồi ha, có vậy thôi ha.
Cảm ơn thầy.
Ok, bye bye ha.
Cảm ơn thầy, chào thầy.
Sáng chứ là tôi là bên tôi là tới đâu gần 12 giờ đêm rồi đây. chưa gấp. Ok rồi, bye nha.
Cảm ơn thầy ạ.
Okay.
Bye bye thầy ạ.
Chào thầy ạ.